then what we also know is that we have our frontal cortex, and both frontal cortex is on the right and left. We know that there's primary pathways that come down that we refer to as our frontal striatal networks, okay, that are trying to always keep a modulation on these more limbic pathways, okay. And we also know that inflammation can have a real big effect, especially neurogenic inflammation in the frontal cortex, and that all of a sudden now we can inhibit those mesolimbic pathways. So now those pathways are coming to a higher level of excitation. So in an inflammatory state, we get the onslaught of activation to the mesencephalon regions, but we also can dampen the frequency of firing of our frontal lobe, and now we lose inhibition. And so at the thalamus level that we've talked about briefly, is that the thalamus is just cranking away. It's getting bombarded with a lot of this sensory input that when our brain is healthy and not inflamed, we modulate that input.
Right.
So now we get these patients that are really wound up, and